Hello, my name is Perry Tsuruoka, and I am a honors student here at the University of Hawaii School of Nursing and Dental Hygiene, and I'll be graduating with my bachelor's in science in nursing. So I'm here today to just talk to you a little bit about my research project entitled Process Outcome Measures of Patients with Head and Neck, Thoracic, and Gynecologic Malignancies seen in the Multidisciplinary Cancer Care Clinic. So cancer is a major disease in the United States, and I'm sure many of you have experiences with cancer, whether it was family members, friends, or even yourselves. So, what's thought to be the best possible treatment option for these cancer patients is what are called multidisciplinary clinics, or MDCs. So, what MDCs are, they're a coordinated clinic. Basically, the team is comprised of a group of physicians, oncology nurses or cancer nurses, and other support staff such as social workers and patient navigators. And all of them work together with the patient. The patient is also part of the team and is in the center of the team, actually. So they all work together with the patient to come up with a treatment plan. And they work with the patient all the way from the time of diagnosis through treatment, all the way through to follow-up care. So that's a little bit about what multidisciplinary clinics are. And that's what's widely utilized in cancer treatment today. And it's thought to be one of the best possible treatment options for our patients. However, in the literature, there's actually very little empirical evidence that shows MDCs are actually the best type of cancer treatment possible for patients. So what my study undertook was to gather some of this baseline data and see if we could collect some data and run some statistics to get some baseline data to see whether or not the MDC is actually an effective treatment approach for these cancer patients. So basically what my study did was we took 3 groups of cancer patients, head and neck. Head and neck included thyroid and all other types of head and neck. And thoracic included lung and esophageal, and gynecologic cancers. So what we did with those 3 categories of cancer, we did a retrospective chart review after we received approval to conduct the study from the Queen's IRB. And we looked back in their chart to collect some data. So basically the research questions of my study was, number 1, what was the average time to first treatment after referral to the MDC at the Queen's Medical Center in Honolulu? So that was question 1. Question 2 was, what percentage of patients are adhering to their treatment plan as formulated by the MDC team? Third research question was, what percentage of patients are utilizing the support services that are provided by the Queen's MDC, Cancer MDC? And the fourth question was, what percentage of patients treatments are following national cancer treatment guidelines in their care? So those were the 4 research questions for my study. And we looked at a total of 222 patients seen in the Queen's Cancer MDC from January 1st, 2012 to December 31st, 2012. So we looked back into the chart to collect data such as the referral date to the Queen's Cancer MDC, to the date of their first treatment, whether it was chemotherapy, radiation therapy, or surgical therapy. And we also looked to see what kinds of services they were referred to and were using. We collected certain demographic factors such as age, gender, ethnicity, and so forth. So those are some of the data we collected in our retrospective chart review. So after we collected our data and we ran through some of the statistics, both descriptive and inferential, we were able to answer our research questions. So after running the stats, what we found was, for research question 1, average time to first cancer treatment. So not including diagnostic testing such as X-ray or imaging studies, but the actual first cancer treatment. We found that for all cancer categories included in this study was 32 days. So that's actually, it seems pretty long for these patients to be waiting over a month to receive their first cancer treatment. So I'll talk to you a little bit more about those results. And then what we also found regarding that research question was patients in the gynecologic cancer clinic had significantly fewer days to first treatment than those seen in the head and neck cancer clinic. So that was our answer to research question 1. So for research question 2, we found that the average percentage of patients who were adhering to their treatment plan as formulated by the MDC team was 99.5%. So this was really good. And we didn't find any statistical significance between any of the cancer subcategories for this research question. For research question number 3, utilization of ancillary services, ancillary support services, we found that the average percentage of patients who used at least one or more of these support services provided by the Queen's MDC was 70.9%, so just under 71%. So you may be thinking 71%, it's not that great, but I'll talk to you a little bit about some of the statistical analysis behind that in just a minute. So and for research question number 4, adherence to national cancer guidelines and treatment received, we found that 100% of patients, so across all these 3 categories, every single patient included in this study had treatment that followed national cancer treatment guidelines. So that was really good. So going back to some of the discussion, for research question 1, I mentioned that the average time to treatment was 32 days for these cancer patients. So 32 days, that's more than a month. So we're hoping that future studies can analyze things such as factors that may have contributed to delays in treatment, because a month seems like a little bit too long. Like if it was your parent or your brother or sister, you wouldn't want them to be waiting over a month to receive their first cancer treatment. So we're hoping future studies can look into factors such as, was it delays on part of the cancer MDC at Queen's? Like, was there trouble in scheduling patients for diagnostic procedures or laboratory tests that further delayed treatment? Or were there certain patient factors, such as were they so overwhelmed by their diagnosis that they didn't show up for their appointment, or they needed more time to think about their treatment options? So what factors were contributing to those delays? So we're hoping future studies can take a look at that. And as I mentioned before, those in the gynecologic cancer MDC had much fewer days to first treatment than those in the head and neck. So we're hoping to look at some of the differences, some of the factors that may affect the head and neck clinic versus the gynecologic clinic. So in future studies, we hope to address those types of issues. So for research question 2, the adherence to the MDC treatment plan, that was at 99.5%. That was really good. So, but we're hoping in future studies they're able to analyze the themes, like if during planning the MDC treatment plan, when the patient is sitting down with the team discussing their treatment options, are there changes in the plan that could lead to delays in treatment, such as the team and the patient reach a decision about what course of action, what course of treatment to take, but then maybe 4 or 5 days down the line or a week down the line, the patient calls the doctor back and says, you know what, I thought about it for a little bit, but I think I want to pursue this path instead. So do those types of factors also contribute to delays in treatment, even though they're following their plan? Perhaps changes in the treatment plan may be delaying treatment. So we're hoping future studies can look into those types of factors. So for research question 3, the utilization of support services, the percentage of patients, we're hoping that future studies can kind of target if certain types of support services, for example, like social work, planning insurance issues or transportation issues, do certain services correlate with shorter times to first treatment? So we're hoping future studies can take a look at factors such as those. And then as I mentioned before, you may be thinking that 70%, 71% is not that great in terms of patients using at least one or more of the services provided, but it's important to consider that in this study, some of the patients only required observational therapy, or pretty much what that means is the patient came in, they had their diagnostic tests, and the cancer was determined to be not malignant at the time, or they didn't need any treatment type at this time. So they were just coming back every 6 months or every certain amount of time to just monitor the cancer or the tumor. So some of those patients may not have needed or may have declined services. So that may explain some of the reasons why that percentage was around 70. But definitely future studies needed to see what kinds of services and the distribution of services, maybe between certain types of ethnicities or distance of patient residences from the Queen's MDC, needed to fine-tune that part. And then finally, for question number 4, since 100% of patients were adherent to national guidelines in their cancer care received, Queen's Medical Center, the Cancer Center, should just continue to ensure all patient treatments are following national guidelines to ensure the best quality of care. So some of the limitations of this study included the ethnic distribution of the sample. So it's representative of the ethnic makeup of this state in Hawaii. However, we can't generalize these to other MDCs, such as in the mainland US, where the ethnic makeup is a lot different. So that was one of the limitations. Another limitation was it was conducted in a single cancer MDC, so it's not going to be able to necessarily be generalized to other cancer MDCs across the mainland US or other parts of the world. And another limitation was the sample could be bigger. 222 was a pretty good size, but there could always be more, and of course we could always include more cancer groups in the future. Again, the study only included those 3 major categories of cancer, chosen because they're less extensively researched, such as other types of cancers like breast cancer, prostate cancer, or colon cancer, but it's definitely important to include all types of cancer because cancer isn't limited to just a few groups. There's a whole multitude of cancers, and each one of them is important to take a look at. So that was some of the limitations of this study. And basically, we're hoping that future studies can see whether or not that, or add to the data collected by this study and see whether or not the MDC is actually the best way to go compared to other MDCs across the nation, across the world, or even non-MDC care to see whether or not cancer patients are getting quality of care in this MDC setting. So that's been about my project, and now I'll talk to you a little bit about my honors experience. It's definitely been a ride, ups and downs. It's been very difficult sometimes to balance schoolwork on top of doing honors research, but it's definitely worth it in the end. I would encourage you to apply for the honors program if you're passionate about research, if you have a burning topic that you want to find more about, because it's really important for people to do research to contribute to the growing body of nursing knowledge. And even if you conduct a study, you don't get the results you're looking for, there's no junk results. Even if you find nothing in your study, that's actually finding evidence in the way that there's nothing to support what you're looking for. So you still have contributed to that body of nursing knowledge. So I would encourage you, if you're passionate about research, to definitely sign up for honors. And another highlight of my honors experience was receiving funding to travel and present my project through a poster board I went to the Oncology Nursing Conference in Cleveland, Ohio. And Cleveland, their clinic is one of the most renowned cancer treatment centers in the nation. So that was an amazing experience. I was fortunate enough to be funded through the Undergraduate Research Opportunities Program. They work hand in hand with honors to give undergraduate researchers a chance to receive funding and travel and present their findings at national conferences. So that was probably the highlight of my honors career. And it just taught me a lot about not group work, but mentorship and working with a team of professionals. Like, I was able to work very closely with both my honors advisor and my advisors at the Queen's Medical Center. It taught me a lot about teamwork and a lot about the effort and time that goes into performing research. So that was a great experience, and I'm definitely better prepared should I decide to go back for graduate school and conduct research in the future. So I'd just like to thank you all for taking the time to listen today, and I hope you consider signing up for honors.